Welcome back, and thanks for joining me again today. My name is Dr. James Keller-Shabroek. I'm a physical medicine rehabilitation specialist focusing on injuries to the musculoskeletal system. These podcasts are primarily focused on injuries to the body and the rehabilitation exercises and various augmentative therapies that can be done to help you regain your lost function back. Today's podcast will focus on back pain. Back pain is a very broad term that can result from multiple different injuries to several areas in the body. The focus of today's discussion will be a common form of back pain, typically related to the joints or arthritis in the back. Now, just because I say arthritis doesn't mean that it is isolated only to an older individual. Joint pain can happen from a sprain, a strain, from age, coupled with increased activity over a weekend, moving, picking up a child, twisting in a funny position, even grabbing some groceries out of the back of the car, not using good biomechanics. There are several structures in the back that can be involved in an injury like this. Most commonly, muscles are always involved. And so in the initial stages of back pain, muscles spasm and become tight. Using ice for acutely injured muscles can help them not hurt so much. However, ice has a tendency to cause things to become a little bit constricted and tight. And so sometimes using heat instead of ice, specifically after back pain has been present for a while, will actually help to relieve the tension in the muscles. But again, the focus of today's discussion is focusing on the joints and the biomechanics of the body and how they put extra stresses on the joints and the things that we can do to help relieve that stress on those joints so that they can properly heal. Frequently what happens is individuals injure their back with a lifting or twisting motion. Sometimes even sleeping funny can cause these things to present themselves. When it comes to back pain, there are several key muscles involved in helping to relieve the stressors on the back, but also prevent recurrence of back pain. Core muscles are an integral part to maintaining good posture and balancing out the tension put on the back during various motions. Frequently, when people think of core muscles, they think of primarily abdominal muscles, specifically sit-up muscles. And although that does play a role, there are several other core muscles that you need to think about when thinking about the back. If we look at the body and we say for the sake of discussion that the back is here, really everything that wraps around from the sides to the front, as well as above and below this region of the body, I would like to consider core muscles for the sake of this discussion. And so when we look at the lumbar spine, the muscles that are above are the latissimus dorsi. The muscles that are below are the gluteus muscles, specifically the gluteus maximus muscles, or your butt muscles. And then wrapping around to the front of the body, we have the muscles on the side, which are your obliques and transversus abdominis muscles. Again, the muscles that most people think of when they think of cores, they think of the rectus femoris, which are the muscles right here in the front. And although they're important, they will not be a part of our discussion today. The exercises associated with these core muscles include, for the latissimus dorsi, rowing motions. And I'll show you this in a minute. For the gluteus muscles, they include squats. For the transversus abdominis and for the oblique muscles, they are a twisting type of motion. And so these motions, although perhaps counterintuitive to what we were just discussing about a back can be injured with a twisting motion, if we are engaging these muscles when we're moving, it is putting stress and tension on these muscles, which then hold us in a natural corset, if you will, that prevents our back from being overly stressed in these motions. When considering the latissimus dorsi muscles, these muscles are large muscles on the back that come from the lower portion of the back, and they come underneath, oftentimes forming the wings of bodybuilders, coming up, inserting on the inside portion of the arm bone, the humerus. These muscles are significantly utilized in any type of pulling motion. So whether that pulling motion is down or up, these muscles are engaged. Now, for the sake of this exercise, what I would like to focus on is primarily a rowing exercise with your forearms parallel to the ground. Probably the most simple easiest to control and the least stress on the back. I'm going to be using a band like this. You'd like to find some structure in your house. Sometimes you can tie a knot in the end of this band, open a door, place it on the inside portion of the door and close the door, and it will hold it in place. Do not put it on the door handle, as it may come off. Or you can find a post or a pole somewhere, and so you wrap the band around this post, and now I have a rowing machine. So in a position such as this, with my chest elevated, my shoulders down, my scapula retracted, as we talked about before regarding scapular stabilizers, I'm going to step back slightly from this band, and for the purpose of this video, I will come forward just a little bit. So my arms are slightly out in front. Now you can go all the way here if you wish, but again, we're really focusing on form in these exercises, and so increasing the stretch or the pull creates a potential for you to lose form. And so to begin with, until you get the idea of where we're trying to focus on these muscles, I would like you to minimize the amount of total distance that your arm travels. Again, really pulling back, squeezing your shoulder blades and your elbows behind you. Again, ensuring that when you pull, your arms are not coming out like this, they're staying at your sides. And so in a motion such as this, really focusing on using the latissimus muscles, which are from the armpit down to the mid portion of your side, contracting those muscles. Now, if we stand in this vertical position and this bothers our back, one of the things that you can do is you can bend your knees a little bit, pull your belly in slightly, and activate your glutes. And this will relieve the tension. You can also sit in a chair, putting your back against the chair. Again, not to aggravate the back, but really just focus on strengthening those latissimus muscles. Exercise such as these should be done in higher repetitions with lower weights, maybe starting at 10, working up till 20 or 25 repetitions as tolerated. For the oblique muscles, these muscles are activated in a rotational type of motion, even more so in a rotational motion that is either going down or up like this, or the other way, up or down. Now, we need to be able to do this in a way that we're not putting extra stressors on the back. And so really limiting the motion to the control of these muscles only, trying not to activate our large back muscles, which will aggravate the problem. So this motion can be accomplished in one of two ways. The one that I'm most fond of is using our legs. Now, sometimes people will find that holding onto a countertop or a chair on opposite sides of them is beneficial, and the idea is to bring the opposite knee to the opposite opposite shoulder. So knee is going to come up towards the shoulder like this. Again, potentially holding on to something here for balance purposes, and as you're doing this, the idea is to really contract this muscle on the side of your body. Really bringing it up, trying to twist and squeeze that muscle together. Now, if you're feeling that this is not a problem for your back, you have relatively good balance, and you would like to intensify the amount of this activity, what you can do is actually allow your leg to extend behind you, really stretching this muscle out, and at the same time reaching up towards the ceiling on the other side, and then bringing your elbows down and your knee up together in a position like this. Really reaching out, really engaging this muscle as you go up and down like this. So again, simple exercise would be knee up towards the shoulder, really focusing on squeezing this side of the leg, this side of the belly every time you do it. And then after performing perhaps 10 to 15 of these exercises, then to switch sides and do the same thing on the other side. Again, the most simple of the versions this way, perhaps a slightly higher step up would be extending your leg backwards, pulling your knee up from a greater distance, or potentially adding your elbow to knee motion like this, really trying to increase the tension and full utilization of these oblique muscles. All the while remembering not to turn on your back. The last of these 3 core stabilization exercises is a squat. This can be accomplished in several ways. Frequently, when performing an air squat, what people will find who have already injured their back is that holding a position like this increases the tension on your back and becomes rather impractical. For the sake of demonstration, we'll start with an air squat and then create some modifications in a way to prevent the low back from becoming turned on in this process. So what's important for an air squat to begin with is to start with your feet approximately shoulder width apart, sometimes a little wider, and really begin with bending your knees, and you stick your butt out just a little bit, which makes it easier for you to turn on your glutes, which is the focus of this exercise. So as you come down, again, the idea is to keep your weight somewhat back, really to focus on activating the glute muscles, not so concerned about the amount of pressure on the front of your toes, which increases the amount of strain or energy required from your quadricep muscles, but really kind of stay in the back seat and use these butt muscles as the mode from which you're going to lower yourself and raise yourself up. Tightening the glutes resists the downward pull of gravity, and then standing up really activates those glute muscles. Now, I do not, when I'm standing in this position, as I lower myself down, want to go beyond 90 degrees. So you can come down as low as you can feel that you're able to hold, and then as you come up, do not lock your knees out. Keep them bent the whole time, and keep your glute muscles firing the whole time. Don't push your pelvis forward so these muscles have a chance to relax. Keep them turned on the whole time. And so you're going to come down and go up. And really, it's not important at this stage when we're working on back rehab to really push how low we drop our butt. It's really just about getting these muscles to be engaged the whole time. That's the idea. Now, some people will use a ball, and they'll put a ball against the wall, and that will allow them to be even more in the back seat, less tension on the back, and then the ball works in such a way that it slides up and down the wall, and you can really just focus on glute strengthening. The one that I frequently tell my patients is a chair squat. So a chair squat is performed best by using a chair that has arms. You scoot your body all the way to the front of the chair. Most people, when they get out of a chair, they lean forward, placing a lot of their mass towards the knees, and then use their quads to stand up, sometimes even helping out with their arms. And the same idea, when they go to sit down, they put a lot of weight on their hands and their knees. They sit down or they plop in the chair. Again, from the side view, the most typical way for people to get out of the chair is they lean forward like this, really putting a lot of the pressure on their knees, not engaging their butt at all. What I would like to be doing is using more of the glute muscle for this exercise. This can be accomplished by using the arms on the chair as an assistance to raise yourself up. But again, by sitting on the edge of the chair, the first thing you want to do is squeeze your butt muscles together, almost as if it's going to lift you up a little bit higher in the chair. And after you've activated those glute muscles, there we go. After you've activated those glute muscles, using your arms to assist you in those first few inches off of the chair, keeping your torso as vertical as possible, really engaging these muscles the whole way. And again, for sitting down, making sure that the chair is close enough to you, engaging those muscles, reaching back, grabbing the arms in the chair, and just helping your body lower it the rest of the way down, the whole time really focusing on engaging your glutes only, not so much the quadricep muscles or the top of the thigh. Again, performing this exercise 5, 10, or 15 times, trying never to relieve the tension that's turned on in your glutes. And again, the focus of this would be, when you've become really good at these exercises individually, is first tighten the glutes, then engage the abdominal muscles, and in the process really support your back as you're going to sit down, relieving all the tension on your back in this position. And repeat. Now this can be employed in several different locations throughout the house. Anytime you're washing dishes, washing your hands, brushing your teeth. Most of us have a tendency to stand at a countertop with our knees locked, bending forward, placing a lot of stress and tension in these back muscles. Simply by bending your knees, sticking out your butt, activating your butt muscles, and then turning on your abdominal muscles, you can now wash your hands, dishes, brush your teeth, all the while keeping minimal tension on your back. The more that you employ these activities, these muscle groups throughout the day, the more your back has a chance to not be aggravated by the constant tension and compression of those muscles on the joints in your back. The last component to any flexion-based lumbar core stabilization program, which is really what we're learning here, and to focus on relieving tension on the low back and the joints, is to stretch the quadricep muscles and the hip flexors. Tight hip flexors result in people being in this bent over position, or rotating the pelvis anteriorly, which creates less tension on those hip flexors but more tension on the back, aggravating back pain. By stretching out the hip flexors, the pelvis is able to rotate backwards, allowing the back to be more in a flat position, not in this curved or lordotic position. And so stretching the hip flexors is integral to relieving pressure on the lumbar spine. In addition to that, the quadriceps muscles, specifically the rectus femoris, for those of you who are familiar with the breakdown of the quadricep muscles, but for the sake of this discussion, quadricep muscles also takes the pelvis out of this anteriorly rotated position, which relieves tension on the back, flattening the back out. And so the easiest way to stretch the quadriceps for an individual who's flexible enough is to grab the heel, pull the heel up towards the butt, and stretch the quad. Now, this may be difficult as this increases tension on the back. And for those of us that are not flexible enough, this becomes a problem. You can lay flat on the table and either using a band around your ankle, you can pull the band up over your shoulder and stretch that quad. You can have a family member also increase the tension against your quad on a flat position in the bed to stretch this out. Or potentially using a chair. Again, I really encourage all of you to have devices around you, whether it's another chair or countertop for balance purposes, but the idea would be to put your foot up on this chair in a position where now I don't have to reach it, and all I would do is holding onto the sides of something, I'm able to drop my knee down a little bit, and this increases the tension on my quad. Almost to the point where, look, I can almost grab my heel. So as I'm doing this more and more and more, eventually I'll get to the point where I don't need the chair anymore, but stretching that quad is critical. The hip flexor can be stretched multiple ways as well. The most common would be in a lunge, placing my hip, my leg and foot behind me, again making sure that if you're looking at my feet, they're not turned sideways, they're kind of in parallel with my body, and stretching behind like this. Now, one of the things you don't want to do is you don't want to arch your back. That will increase the stress on your back and the joints and increase the pain. So really kind of keeping your back straight, really tightening your abdominal muscles, and then shifting your pelvis forward will stretch the front of this quad. You can also do it kneeling, where you're on the ground. I find this the most easy to control. Same idea. If your back is hurting, bend forward just a little bit, takes the tension off of your back, and then shift your pelvis forward, really stretching that hip flexor. You also can be dynamic in your stretch. If you have great flexibility, maybe putting a pillow on the floor so as to not put too much tension on your knee, but in the process of doing this, you can also stretch your quad and your hip flexor at the same time. So these two stretches are critical in helping to relieve the tension on the back. Thank you again for joining me regarding the recommended exercises for a flexion-based lumbar core stabilization program for lumbar facet joint pain or back pain typically related to the joints. In some future podcasts, we will discuss more of the pathophysiology and additional treatments available for such a problem. But for now, I would like to content ourselves with just learning these exercises and regaining your life back.